would like to invite the panelists, Hari Narayan Sharma from Manipal. Then I have Raghavendra Rao from GE and Kunal Makkar from DEG. Basically, this has been a discussion since ages. How to make healthcare affordable. Prasanna touched very pertinent points today.
The first is our care system, with whatever has happened over so many years, is still a fragmented one. There are multiple stakeholders, multiple formats, multiple single specialty to multi-speciality, the whole works. Diagnostic centers which are independent. So there's nothing which is common across. Some have been done by doctors, some have been done by medical schools, some have been done by groups like ours, some have been pure ventures. So as a result, what has happened is, there is no commonality in the way business is managed. There is some sense of madness which has found its equilibrium, but there is still a lot of distortion. Now, what this fragmentation has done, in my view, it has also created a big skew in the availability of skill. Because the higher paying cities and towns have been able to afford the best of talent is not willing to serve in the tier 2 and tier 3 towns even now. Though there has been a significant shift since the 80s, still then the gap and the need for skill in the lower levels of townships are still missing. The access to authentic care is still a missing element. And if I address all these three, which is access, affordability, and authenticity, there's one more missing element, which is the asymmetry. And that has a function of the pricing. Definitely, technology seems to be an enabler. This fragmented piece that is happening today in the brick and mortar business, possibly technology has a role to play to integrate. And that's where I see the opportunity for players like GenWorks to really make a difference in the way care is delivered today.
Thank you. Now coming to you, Rao, I think this is something which we've been hearing day in and day out, maybe with greater intensity post-COVID. Prasanna mentioned this in his talk, very briefly though. I want to ask you, because you're the best person to answer, what is this technology? Is it really there in healthcare? And if it is true, how we can leverage technology? And what GE is doing to make this technology come true?
Thanks, Ramesh. A couple of pointers that I would want the audience and everyone here to note. When you talk about healthcare, the ability to move data and the ability to ensure clinicians have tools available with them to make accurate diagnosis most efficiently is the key thing. The other thing is telehealth. I think we have heard everyone speak about this. Is in many ways at the intersection of technology, communications, and healthcare delivery. So when you look at this in the backdrop of what we have with 5G and the mobile phone usage and the number of users, this space is going to be extremely exciting in terms of the impact it will have for healthcare. Currently, I would want all the folks to realize that the benefits far outweigh the pitfalls of the physical touch feel versus face-to-face interactions that many of us probably are used to. I think that's going to have a paradigm shift. Imagine a situation where, of course, not to forget the advent of metaverse and the impact it will have on healthcare. Healthcare by far, among every technology that's available today, consumes the highest amount of data. Okay. When you look at analog systems, they consume a quantum of data. When you look to digital, it just becomes 4x and 5x. And when you have this kind of data that needs to be transported and made optimal use, telehealth, network, and how you consume data and utilize becomes paramount importance. That's the most important thing. Many of you probably know GE Healthcare was at the forefront of leveraging this technology for the benefit of clinicians. Be it remote service, on-demand applications, I think these are a few. And I think there is a lot that any organization, and GenWorks specifically, can leverage when they have the backing of great technology provider and the reach of a distribution. More than anything else, a great ecosystem of artificial intelligence startups, right? So when you have all of this come together, what you can drive out of technology for clinicians who are based in far-flung regions, and ensure healthcare delivery at the beginning, is identified and accurately diagnosed, becomes that much more important. And in my view, having a vertical that's focused on telehealth, which GenWorks is doing, is a great start. And leveraging all these pieces of 5G technology and the ecosystem of AI, in my view, would provide much more impetus to telehealth and what technology in many ways can be seen by common man.
I think everyone in their own right, be it from a conscience or otherwise, want to contribute. All of us want to do something for the needy and the deserving. So impact and sustainability is becoming very, very important. You have been a great proponent of this, and so is your organization. GenWorks is somebody who can actually leverage this. But what are the lessons for us? What we should do, what we should not do in our endeavor to make what we do very impactful.
Sure, Ramesh. So DEG is a development finance institution, and the philosophy has always been kind of provide commercial capital, but at the same time also have a balance on the impact side. And healthcare, as we invest across the globe in emerging markets, we see in continent like Africa or other kind of weaker economies, the healthcare spend is on the minimum. And that's where institutions like DFIs want to channel and have been channeling funds for healthcare delivery. And looking at GenWorks, I think I can't put it in a better way, but saying that, I think you made it affordable, make it accessible enough, combining with technology to penetrate the length and breadth of the country. I mean, there is a big underserved market in the country. I think that's the key message I would leave here from our experience perspective.
Thank you, Kunal. Hari, the point here is, okay, Rao talked about technology, but can technology actually help in optimizing the asymmetry which you are talking about? Costs are an area of concern. Can we leverage technology to optimize on the cost?
Thanks, Sam. Before I answer that question, there's one little tweak to that. If you see whatever effort that Rao mentioned about technology that has happened, and if you trace it back, most of the technology development has happened from the technology side. Companies like GE have front-ended a whole lot of technology development from the imaging, from the equipment modality side. A whole lot of tech people have developed applications right from registration to scheduling to a whole lot of peripheral services. Now, on the other hand, if there is a method by which the high-end technologies are made available in centers of excellence, but access to that is enabled through a good technology platform, I think then we can address two crises together. One is skill availability, and the second is capital employment at a far more efficient manner. So that's one way I believe technology will have to play a role in reducing the cost of care as well as ease the availability of skill. And that's a role which I was just thinking is what a GenWorks can play, because they understand medicine, they understand care. They also understand tech or can bring technology.
Let us get down to some specifics. There is GenWorks, which a large part of the credit goes to GE as well. And there is GE. you are pursuing a certain business objective, so is GenWorks. I've been a great proponent of leveraging the strengths of JE and GenWorks to make it bigger and better. Now that you are here, I want a honest answer from you as to how we can leverage the strengths of GE and GenWorks so that the net impact on the people is far better.
I think the genesis of GenWorks predominantly is based on how two centers of expertise come together. One is product and technology leader, and on the other hand, you have commercial intensity and distribution strength. I think these two put together is the genesis of GenWorks. In many ways, for the last 8-9 years that we have been together, I think we have done many right things to ensure that we make a big impact for healthcare within this country. When you're looking at a country like India, where the population is huge, the disease burden is fast growing, and the coverage that we need to provide is about 700 plus districts. And relaxing in the night thinking that we are doing a good job, I think that to me is something can make people sit up and think whole night and many quarters and months and years in terms of what's the right recipe. And if I could take a figure out of the point that you had mentioned, I think what we probably should do is how effectively we work together to build talent management program. I think the terrain that the team operates in, the skill levels and the competencies with which the clinicians are having as a baseline, I think there is a lot in my view that we could do both to our teams and the external world as well. So in my view, coming together and creating plans that are around talent management for GenWorks team and also competency-based programs to make an impact with clinicians are probably two important things that we should do, which will make us be seen more as a partner who is invested in growth of the internal teams, and more than anything else, also as a partner with clinicians who are looking for something over and beyond just the transaction or the product or the service.
Thank you, Rao. Kunal, the challenge always has been, do I get optimal money? I wouldn't say capital, it can be debt also. So long-term, low cost, moratorium, so many things go into play to make finance more affordable so that the end product can also be affordable. How can somebody like DG actually contribute to this endeavor and what all it can offer? I think a good understanding of what DG can do generally and for GenWorks would be real useful.
So we heard Mr. Prasanna talking about financing not being available, though things are much better now, right? But at the same time, if you look at it, this is a sector, an industry, which needs a good breathing space, a good gestation period. But if you go in the private banking space or private foreign commercial banking space, you don't get the adequate tenors. So what we see the market as being, who the banks are providing these facilities are either public sector, or then the space is filled by the multilateral and bilateral finance institutions. So we have a longer runway to provide to the companies based on the business model requirement rather than fixing the tenors the other way around. We look at the necessities and the requirements of any business and accordingly provide those adequate tenors with adequate moratoriums. Now, pricing, or you said some discounted pricing, that's, I think, in the present scheme of things, as the world looks like, is going to be a challenge because all of us have been now in the interest rate rising scenario. But here, the role of DFIs is not to maximize the profits, but also be self-sustainable for their own balance sheet. So these are not really exorbitant interest rates that we charge. They are largely in market terms. But I think the big benefit is that you get long-term financing, and that's what we are looking at with GenWorks as well, right? Which I think gives the runway also to the company to grow at a balanced and a stable pace.
Any other sectors you have funded which you think you're very happy with? Financial services, automobile, what are the sectors you have funded?
So we are actually across all the sectors: infrastructure, financial services, manufacturing. Since we are here talking about healthcare, we've been in healthcare sector directly and indirectly through also our private equity funds. And I would say success rate has been 100%. It's kind of, I think the key underlying factor is selection of the partners. And if you talk about GenWorks, kind of two good things meeting, I'm sure that it's a success has already been proven here.
I think the question is a little more specific. In healthcare, you said you have worked on multiple players. What are things you think GenWorks should do to make this business more meaningful?
If I look at from a financing perspective, the key ingredient would be the business model itself, which kind of whether it's in sync with the requirements of the markets. Second, you have enough financing to operate that in a very stable way to be resilient as well. And third would be governance standards. I think I mentioned governance standards in the end, but I think that stands number one because everything starts from there.
Okay, before I come to an end to the session, I want to pose a question to all three of them, and hopefully we will take back a very strong message and action plan. Your Manipal Foundation is GE and is DEG. And there is GenWorks. The question is, can you come together in some form or other which can meaningfully do something to business which we'll be proud of?
So, just as a matter of pride, we are working with the GenWorks team to do an extensive cancer screening program. We're starting with 3 pilots in 3 regions for women cancer screening, with the idea to expand it to whole districts. And this screening is being funded by the foundation on a pilot basis in Karnataka, Jharkhand, and possibly Sikkim, where we have medical colleges. The whole idea is to see how through minimally invasive technology and a cost-effective screening mechanism can we accelerate the screening process. And the conviction that our medical team has had is that the faster we screen and the accelerated screening will actually prevent the disease progression better. So the whole effort is to prove a point that if you screen early and in a regular manner, you will be able to arrest the disease from becoming a very cost inefficient for the family, debilitating for the family. So efforts of this nature is what we want to begin with as a foundation and as a medical college teaching hospital network. We are bringing 2 skills together: our clinical capability and therefore the research that will go along with it, and the foundation's ability to sponsor such efforts is a beginning that we have made with the GenWorks team.
You really think that going forward you can build a more stronger relationship?
Yes, I believe that we can, and one of the things that I missed out mentioning is this whole primary care network. As of now in the country, the primary care network just doesn't exist on the private side. But there are models which we can, and the reason why it has not worked is because again the equipments are not efficient, clinical skill is not available. Through technology, through a much more capital efficient product that a GenWorks platform can bring, if we can create a very holistic primary care network, I think that will be the biggest change that we can bring in the healthcare system. And I'm sure we would have sponsors willing to sponsor such primary care.
Rao.
Yeah. I have two thoughts, that we could probably look at. Connecting the points that we have heard in the keynote address and, the past questions through the panel. Couple of things. I think the past world was more about how do I get more entrepreneurs into the system so that, more entrepreneurs meant more healthcare access, right? And hence, the mantra was how do I get tax ops, how do I make projects connected with capital, how do I look at softening of interest rates so that it becomes easy, right? When you start looking into the future, when you have a large pool of healthcare facilities, I think the mantra is more about how do you build capacity and drive efficiency. How do I make people do more with the same, and how do I make that as efficient and accurate as possible with the same?
So healthcare is our key focus area of investment, and given what we've seen in the last 3 years, I think it gets even more, gets into more attention now in the present set of things. So I would kind of say that we are very much keen, and we are evaluating GenWorks. We've been following them for a couple of years now. As we get comfortable, as the company is growing, I think, of course, we have to, I'll be selective in saying that because of my organizational requirements, but it's until it's not done, it's not done, but we are really keen to work in this sector and work with partners like GE and Wipro here.